Welcome to our Menopause and You Chat with a Physician, sponsored by Women's Health Source. I'm Dr. Beverly Vaughn, a gynecologist at Paoli Hospital and medical coordinator for the Menopause and You online program. I'm pleased to introduce today's guest, Dr. Mojdeh Saberin-Williams, an OBGYN at Paoli Hospital. Our discussion will focus on physical changes that may affect sexual function after menopause. Welcome, Dr. Saberin-Williams.
It's a pleasure to be here.
I find that women most often complain of vaginal dryness and decreased desire. Do you find that in your practice as well?
Absolutely.
What causes vaginal dryness?
When there's a lack of estrogen, which happens at the time of menopause, the vaginal mucosa, or the vaginal walls, they tend to become thin, pale, they lose their natural folds, and as a result, during intercourse, there may be quite a lot of pain experienced.
There can be multiple factors that affect desire. What do you tell your patients that have this concern?
Desire is a complicated issue. The decrease in desire can be due to either medical conditions such as heart disease or depression, medications which decrease libido, a decrease in testosterone which comes with the onset of menopause and even before that, a change in the relationship between the two people. So the core cause of the problem needs to be looked at.
What steps can be taken to resolve these two issues?
The issue of the vaginal dryness can be dealt with in various ways. For some women who don't have severe vaginal dryness, over-the-counter lubrication may be all that is needed. For other women, estrogen lubrication, which is a prescription, works much better. Hormone replacement therapy or hormone therapy also would cover vaginal dryness. As far as the sexual intimacy and desire is concerned, it is a good thing to look at the underlying cause. If the reason for the decreased libido is medication, talking to the doctor and seeing if one can change one's medication may be of benefit. If the problem is the disease itself, such as depression with low libido, the treatment of the depression, on the other hand, will be beneficial to the libido of the person. Also, at some points, there may be some psychosocial issues that are involved, and the couple may want to refer to a specialist who deals with sexual disorders.
What about testosterone? Can that be beneficial?
In a subset of women, because of the decrease in testosterone levels, which is directly linked to libido, adding a little bit of testosterone is actually very beneficial. It is off-label, it's not FDA approved, it has to be prescribed by the physician, and it should probably not be used for more than 5 years, just because we don't have any longer term data.
Thank you, Dr. Saberin-Williams, for being here and sharing such valuable information with our audience.
It's been such a pleasure.
Thank you for joining us today. We hope that you learned something new during this webcast. To learn more about menopause, visit our online library of over 30 articles on the Menopause and You website.